PID, pelvic inflammatory disease, is one of the major causes of infertility in women worldwide. Today, we are going to talk about the link between PID and infertility. If you stay a little bit longer, you're going to know how bacteria travels to your fallopian tube and causes infertility for you, and how you can prevent this PID and how you can treat this PID. My name is Pharmacist Rubby. If you find this video interesting, stay to the end. Now let's get into this video. What is PID? PID is simply pelvic inflammatory disease that is caused by some bacteria like chlamydia, gonorrhea, and others. There are so many other bacteria that causes PID. Now, what are the signs and symptoms of this PID? We have lower abdominal pain. You're going to feel pain on your lower abdomen. You're going to have painful sex. You're going to have frequent urination and painful urination. While urinating, you're going to feel a lot of pain. And you're going to have vaginal discharge. These are the signs and symptoms of this PID. Now, let's get into the main reason for this video. The link between PID and infertility. How is it connected? How does PID cause infertility? When you have unprotected sexual intercourse with a partner that will give you these bacteria like chlamydia, gonorrhea, and others, these bacteria travels from your vagina to your cervix, to your uterus, and finally to your fallopian tube. When it gets there, it causes inflammation on your fallopian tube. So after healing, when you finally treat these bacteria, there will be scars on the tissue in the fallopian tube. There will be scar. So this scar now can cause narrowing of your fallopian tube or total blockage of your fallopian tube. Now, when it blocks your fallopian tube, sperm cannot travel to meet egg for fertilization. Remember, after sex, sperm travels to your fallopian tube to meet the egg on your fallopian tube for fertilization to occur. So because there is blockage of your fallopian tube, there won't be a space for the sperm to travel to meet the egg. In the case where this scar causes narrowing of this fallopian tube, the sperm will travel to meet the egg. After fertilization, the zygote cannot travel back to the uterus for implantation because the fallopian tube is narrow. So the zygote cannot travel back to the uterus for implantation. So the implantation will now happen on the fallopian tube. So when implantation happens on the fallopian tube, remember, the fallopian tube is not like uterus that expand. Uterus expand. As the baby grows, it expands and accommodates the baby. But the fallopian tube does not expand. So as the baby grows, it ruptures. The fallopian tube will finally rupture. This is two different ways PID can cause you infertility. Now, how do you prevent this PID? You prevent it by using protection. Use condom. If you don't trust your partner, use protection. Another way is by avoiding multiple sexual partners, because those your numerous sexual partners, they also have their numerous sexual partner. Another way is by avoiding douching. Stop douching. Douching will cause you more harm than good. Again, stop inserting your fingers into your vagina. The vagina is self-cleansing. It cleanses itself. Let's say there is already bacteria in your vagina. Now, you want to insert your hand in your vagina to wash it. As you're inserting your hand, you're pushing that bacteria upward to your cervix, to your uterus, finally to travel to your fallopian tube. That is why you need to stop inserting your hands. You can wash your vulva, but the vagina is self-cleansing. You don't need to wash it. These are the ways you can prevent PID. Now let's talk about treatment. If you have been diagnosed with PID, your doctor is going to treat you with 3 different classes of antibiotics. 1, the tetracycline. 2, the nitroimidazole class. The third one is the fluoroquinolone class. He's going to use these 3 different classes of antibiotics to treat you properly. Remember, don't self-medicate. If you have any health issue, go and meet your doctor. Self-medication is very, very bad. If you learned something from this video, don't forget to share and don't forget to subscribe to our channel. We'll see you on our next video. Bye bye.